fear-mongering and misleading claims from our colleagues. So let's be absolutely clear. For the Americans who truly need them, this budget does not cut Medicaid, Medicare, or Social Security benefits for the Americans who truly need them. We are strengthening and protecting Medicaid for pregnant women, children, individuals with disabilities, low-income seniors, and vulnerable families. These Americans will continue to have access to the care they need and deserve. What we are doing is eliminating waste, fraud, and abuse, because safeguarding taxpayer dollars is not heartless, it's responsible. We're ending free health care for illegal immigrants, stopping payments made on behalf of deceased individuals or duplicate enrollees, and halting federal reimbursements for transgender surgeries on minors. It's not slashing care. It's restoring integrity and ensuring Medicaid works for the people it was meant to serve. And don't just take it from us. Even the New York Times published an article this week titled, even the New York Times published an article this week that stated that the Democrats' $13.7 million claim, or 13.7 million people losing Medicaid claim is false, is inaccurate. When the New York Times is calling out the Democrats for their exaggerating and misleading information, it's time to stop the scare tactics. This budget reflects our commitment to preserving these essential programs for future generations while also demanding much-needed accountability in the system. The American people want health care that is accessible, affordable, and honest, and that's what we're trying to deliver. So let's stick to the facts. Under our plan, 1.4 million illegal immigrants will no longer get coverage, so the very people that my colleagues on the other side of the aisle are trying to protect will be protected. 4.8 million able-bodied adults choosing not to work or volunteer in their communities will be affected. 1.2 million recipients who are not eligible will no longer receive coverage. That is because we want to protect these programs for the very people that have been mentioned today by our colleagues on the other side of the aisle. We stand with them to protect the program for those people, but the status quo cannot continue. We cannot continue to keep spending 90% of every dollar on able-bodied adults choosing not to work and only spending 70% of every dollar on the vulnerable traditional people, the disabled, children, pregnant women, and seniors. It is not right. We are trying to fix it, and I urge my colleagues to stop the scare tactics. I yield back.
Gentlelady yields back. The
Mr.
gentlelady
Chairman,
from...
Mr. Chairman, I ask unanimous consent to place